All right, let's dive into a real medical mystery. We've got a clue that's hiding in plain sight. And trust me, in a case like this, every single second counts. Making the right call right away, that can change everything.
So picture this. We've got a 60-year-old guy. It's just a totally normal morning, right? He's chilling at home, watching TV, his family's there. Everything is completely fine.
And then, bam, out of nowhere, something is very, very wrong. His family sees it right away. He's suddenly super confused. He tries to talk, but his speech is all slurred. Just like that, this calm morning becomes a full-blown medical emergency. Okay, so now you're the one on the scene. You walk in, you see this guy, and you know you've got to move fast. That first move you make is critical. So what do? What's the most important test you can run right this second? That's the puzzle we're about to piece together. We're going to treat this just like a detective case. Using clinical reasoning, we'll look at all the evidence and figure out which assessment is most likely to tell us what's really going on. To crack this case, we have 4 main tools in our toolkit. You can think of these as our primary leads. Each one could give us a totally different piece of the puzzle. So here are our options, laid out right in front of us. We can check his blood glucose, his sugar levels. We can check his oxygen saturation, see if he's getting enough air. Maybe check for a head injury, or we could take his blood pressure. All of these are good things to check for sure. But which one is going to give us the answer we need, like right now? Okay, let's put our number 1 suspect right under the spotlight, his blood sugar. So why are we zooming in on this one first? Well, because the symptoms our patient is showing are telling a very specific and a very urgent story. The condition we're honing in on is called hypoglycemia. And really, all that means is that the amount of sugar or glucose in the blood has dropped way too low. And this is a huge deal because, your brain pretty much runs on one thing, glucose. It's the fuel. So what happens when you take the fuel away from an engine? It starts to sputter and stall. That's exactly what's happening in the brain. Just look at this evidence. It makes hypoglycemia our top suspect, hands down. The classic symptoms are a perfect match for our patient. Confusion? Check. Slurred speech? Check. The source material even says it can look just like a stroke and come on super fast, exactly like what happened here. It's a textbook match. And here's the kicker. Checking blood glucose isn't just a hunch. It's the absolute best first move. Why? Well, for one, it's super fast. We're talking a simple finger stick. It's also incredibly specific, pointing us right at the problem. And maybe most important of all, we can act on it immediately. If that number is low, we can start treatment on the spot. All right, let's look at the other clues, because this is how we really build our case. A good detective doesn't just get fixated on one suspect. Nope, they rule out the other possibilities to make their conclusion rock solid. So what about a head injury? The key here is the history. The family said he was just watching TV. There was no fall, no accident, nothing like that. So yeah, you could check for trauma, but it's really, really unlikely to be the cause of these symptoms in this situation. Okay, how about his oxygen levels? Low oxygen or hypoxia can definitely cause confusion. But here's the thing, it usually doesn't show up alone. You'd expect to see other signs, like shortness of breath or weird breathing patterns. Seeing this sudden confusion all by itself with no respiratory issues, it makes hypoxia a much less likely culprit. And what about blood pressure? Look, super high or super low blood pressure can mess with your brain, for sure. But it's what we call a non-specific finding. It tells you something is wrong with the whole system, but it doesn't point to the direct cause of the confusion nearly as cleanly as a glucose check does. So, after we've weighed all the evidence, we've ruled out what's less likely, and we focused on the facts, we land on the definitive answer. We now know what that clinician's first, most critical move has to be. And there it is. The source material confirms our whole investigation. It couldn't be clearer. The blood glucose level is the one test that's going to crack this case wide open. So let's break this down into a simple playbook, right? 3 steps. Step 1, you see these sudden, acute neurologic changes. Step 2, you immediately check that blood glucose. And that lets you get to step 3, the big one. You either confirm or rule out a problem that's super serious, but also super reversible. And this is really why this is all so important. What looks like a devastating stroke, something that could be permanent, might actually be hypoglycemia. It's a serious condition, but it's one you can potentially fix in minutes. This one simple test could literally be the difference between a full recovery and a tragic outcome. You know, a case like this is such a powerful reminder, isn't it? Sometimes the scariest, most dramatic symptoms can have a surprisingly simple fix, if you know where to look. It really gets you thinking, what other common conditions are out there, hiding in plain sight, pretending to be something else?